Have you ever woken up with a stiff back and wondered, is this just aging or something more serious? Or maybe you've been using heat patches for months, but the pain keeps coming back. You're not alone. Back pain affects over 70% of seniors, and many are silently suffering because they don't know what to do. What if I told you that in just 12 minutes we'll clear up the biggest misconceptions and arm you with real, practical knowledge that you can use starting today? Stay with me, because the truth might surprise you. Today, I'll answer the 5 most common and important questions I get from my senior patients about back pain. And chances are, you've asked at least one of these questions yourself. This video might just change the way you think about back pain. Forever. Welcome back to ZenSenior, the place where we talk about real health problems faced by older adults and how to overcome them. I'm Dr. Smile, and I've spent over a decade helping people just like you deal with back pain, joint stiffness, and movement issues. My mission is simple: to give you straight, compassionate, and actionable advice. No fluff, no fear-mongering. Just honest answers. In every episode, we break down complicated medical issues into easy-to-understand tips. Whether you're a senior yourself or a loved one caring for aging parents, this channel is your go-to resource. And today's topic hits home for almost everyone over 60. Back pain doesn't just cause discomfort. It affects your ability to move freely, enjoy time with family, and live independently. That's why this video is so important. Because knowledge isn't just power, it's freedom. First one. The first question is probably the most common one I hear. Doctor, why does my back hurt the most in the morning? The answer is actually simple. And no, it's not always arthritis. When we sleep, especially as we age, our muscles and joints remain still for hours. That lack of movement causes the joints around your spine to become stiff. Think of your spine like a sponge. When it's still, it soaks up fluid and becomes stiff. When you move, it warms up, becomes flexible again, and the stiffness fades. It can also be due to your mattress or sleeping posture. A mattress that's too soft or too firm can put pressure on the lower back, and if you're sleeping curled up or flat on your stomach, it puts the spine in an awkward angle. Even the height of your pillow matters. A high pillow can throw off spinal alignment. Many seniors also have a condition called degenerative disc disease. During the night, the discs between your vertebrae can swell slightly due to rehydration, making you feel stiff when you first wake up. As you move throughout the day, that fluid redistributes and you feel better. It's completely normal, but frustrating if you don't know what's happening. So what should you do? Try gentle stretches before getting out of bed. A good one is the knee-to-chest stretch, slowly and gently done while lying down. Also, try doing some light pelvic tilts. Avoid high pillows or sleeping on your stomach. Consider a medium-firm mattress that supports your back well. Keep your room temperature warm. Cold rooms can make morning stiffness worse. And don't underestimate the value of proper sleep hygiene. Morning back pain is common, but with a few adjustments, it doesn't have to be part of your daily routine. Let's move on to question 2. Do I need an MRI if I've had back pain for a long time? Great question. The truth is, not always. Most back pain is mechanical, meaning it's due to muscle strain, joint wear, or poor posture. Not something dangerous. However, here are some red flags that tell us you might need an MRI. If the pain radiates down your legs, a sign of possible nerve involvement or sciatica. If you feel numbness, tingling, or weakness in your legs. If you're experiencing trouble controlling your bladder or bowel. or if the pain doesn't improve at all after 6 weeks of rest and conservative treatment. These signs could indicate conditions like a herniated disc or spinal stenosis that may require more in-depth evaluation. Also, if your back pain began after a fall, car accident, or trauma, it's worth looking deeper. If you have a history of cancer, unexplained weight loss, or fever, you may need further imaging too. These aren't meant to scare you, but to help you recognize when back pain might be more than just getting older. On the other hand, if the pain is mild to moderate and seems to get better with rest, movement, or physical therapy, an MRI might not be necessary right away. Often we start with simple measures like posture correction, gentle stretching, and heat or cold therapy. Persistent pain should always be checked, but not all pain needs a scan. Remember, imaging is a tool, not a solution. Don't rush to get expensive tests until you've tried basic care, and always speak to a trusted healthcare provider. Question 3. Can I use heat patches and pain relief creams every day? This one is tricky. Many seniors use over-the-counter heat patches, creams, or even herbal oils every day. They say it gives them relief, and it often does, for a while. But here's what you need to know. These treatments only manage the symptoms, not the root cause of your pain. Overuse can cause side effects. Heat patches, for example, can irritate your skin if used too often or applied incorrectly. Creams with strong ingredients like menthol, capsaicin, or NSAIDs can cause rashes, allergic reactions, or even be absorbed into the bloodstream and interact with medications you're taking. Another thing to keep in mind is that your body can build a tolerance to topical treatments over time. That means they'll feel less effective the more often you use them. Plus, constantly masking pain might make you less likely to do the actual stretches or exercises needed to fix the problem long term. So what's the safe way to use them? Use heat patches for no more than 20 minutes at a time, once or twice a day. Always apply them over clothing or a thin cloth, not directly on bare skin. Rotate application areas. Don't apply to the same spot over and over again. If you're relying on creams and patches every single day for weeks, that's a red flag. It means the underlying problem hasn't been addressed. Instead, consider alternating with cold packs when inflammation is present, and incorporate stretching or physical therapy to treat the source of pain. Talk to a physical therapist or doctor to create a plan that addresses the real source of your discomfort. Think of creams and heat as temporary helpers, not long-term friend. Question 4. I'm taking calcium supplements. Why does my back still hurt? This is one of the most misunderstood issues. Many seniors believe, I take calcium, so my bones must be fine. Why do I still have back pain? Here's the truth. Calcium helps with bone strength, especially if you have osteoporosis. But most back pain doesn't come from bones. It comes from tight or weak muscles, herniated discs, joint inflammation, or nerve pressure. Taking calcium is a great start, but it won't help if your muscles are too weak to support your spine or if your joints are inflamed from years of overuse. Think of it like this. Taking calcium is like fixing the foundation of a house. But if your roof is leaking or your windows are broken, you still have a problem. Similarly, you can have good bone density and still suffer from back pain caused by non-bone structures. If you want better results, combine calcium with vitamin D and weight-bearing exercises like walking or gentle resistance training. Resistance bands and light dumbbells are perfect for seniors. Regular movement not only strengthens bones, but also keeps muscles active and joints lubricated. You should also get a proper diagnosis to rule out other causes. If you've been taking calcium for months and still hurt, it's time to look deeper. Ask your doctor about your muscle balance, core strength, and posture habits. pain has many layers. Question 5. Should I rest more when my back hurts? It might sound logical. My back hurts. I should lie down more, right? Wrong. Extended bed rest is actually one of the worst things you can do for chronic back pain. When you stay in bed for too long, your muscles weaken. Blood circulation slows down and inflammation can actually worsen. It's a common myth that rest equals recovery. While short-term rest may help an acute injury, for most chronic or non-traumatic back pain, movement is key to healing. Unless your doctor specifically prescribes strict rest, which is rare, you're better off staying lightly active. Try walking for 10 to 15 minutes at a comfortable pace. Gentle stretching, seated yoga poses, or even Tai Chi can all improve spinal health. Just avoid movements that cause sharp pain or discomfort. The most important thing is to listen to your body. Don't push through pain, but don't avoid movement altogether. Your spine is built to move, and it heals better when you use it wisely. Daily consistency matters more than intensity. A little movement every day is better than no movement for a week. Try simple chair exercises or wall-supported squats. Explore low-impact activities like water aerobics or using a recumbent bike. And don't forget to breathe. Proper breathing reduces tension in your muscles and helps you move more naturally. If you've made it this far, congratulations. You're already ahead of 90% of people who suffer from back pain. You're asking questions, you're seeking answers, and that's where healing begins. Let's recap the 5 big takeaways. Morning back pain is common and usually manageable with better sleep posture and gentle stretches. Not every back pain needs an MRI, but know the red flags that do. Heat patches and creams offer relief, but don't become dependent on them. Calcium helps bones, but most back pain involves muscles, joints, and nerves. Movement is medicine. Rest can help, but don't let it become your enemy. You deserve a strong, pain-free back, and it's never too late to start making small changes that bring big relief. Which of these 5 questions resonated with you the most? Let me know in the comments. I personally read and replied to them, and if you found this helpful, please like this video and subscribe to ZenSenior for more real, honest, and simple health advice from a doctor who truly cares. Take care of your back. It's the backbone of your freedom. See you next time.